Batting number 3 in our lineup order today is Heather Schlesser. Heather is an agriculture educator in Marathon County. Heather's research and outreach have included the use of current technology to enhance farm profitability and sustainability. Her current projects include the Animal Wellbeing Conference, the Midwest Manure Summit, Beef Quality Assurance, Farm Financial Programming, and teaching farmers throughout the Midwest AI techniques in cattle. With that, we will turn it over to Heather.
All right, thanks, Ryan, for that introduction. Today, I get to speak with you guys about the use of nonsteroidal anti-inflammatory drugs in cattle after calving. So in this presentation, you're going to see some images of the different products that were used in the studies that I'm going to talk to you about. And by no means consider these as an endorsement for the product. They're just there more to give you an idea of what product was used. So before we begin, let's take a look at what nonsteroidal anti-inflammatory drugs do. So nonsteroidal anti-inflammatory drugs, or NSAIDs, act by inhibiting the enzyme cyclooxygenase, or COX, as I'm going to call it because I can't say cyclooxygenase multiple times. So COX, which causes a decrease in the amount of prostaglandins that are produced within the body. So there's two main forms of COX that have been reported in the literature. So there's COX-1 and COX-2. COX-1 activity is mainly responsible for the day-to-day physiological functions, such as maintaining gut and kidney function, whereas COX-2 activity is generally induced under specific conditions, such as inflammation. So inhibition of COX-2 is thought to account for most and probably all of the therapeutic effects that we see from NSAIDs, whereas the inhibition of COX-1 likely accounts for most of the undesirable effects, such as the gastrointestinal irritation, renal toxicity, and inhibition of blood clotting. So as humans, when we take aspirin, which is an NSAID, and they have the cautionary statements on there, that's probably due to aspirin's ability to inhibit COX-1, where the ability to reduce our headache is due to COX-2, to put it into human terms. So why do we need NSAIDs, or why do cattle need NSAIDs? So the 3-week period before and after calving is one of the most challenging times for dairy cattle because they must cope with physiological challenges such as decreased dry matter intake, impaired immune system function, and increased metabolic and systematic inflammation. After calving, inflammation has been documented in cattle. This suggests that cattle experience some degree of inflammation due to tissue damage associated with calving and immense metabolic demand associated with the onset of lactation. Stress and inflammation related to calving can increase the incidence of disease such as mastitis and clinical metritis. So the hypothesis is that we can use NSAIDs to help reduce the inflammation associated with calving and thus decrease the incidence of disease. So the million-dollar question is, do they work? Well, that answer really depends on the NSAID that you're using. Most NSAIDs commercially available for animal use inhibit both of those COX enzymes with varying selectivity. This means that the results vary depending on which NSAID you are giving. So in today's talk, we're going to look at the results from some research trials that gave flunixin, meglumine, meloxicam, and acetylcyclic acid, or aspirin, because that's another tongue twister for me. So the first one we're going to look at is flunixin. So flunixin meglumine is the only FDA-approved NSAID for use in cattle, and it requires a prescription from your veterinarian. Flunixin meglumine is both a COX-1 and a COX-2 inhibitor, but it is more selective for COX-1. And remember, we want to inhibit COX-2. So the research study we're going to look at today was produced by Newby et al. In 2016. For their study, the first 72 animals that were enrolled in the study were given a treatment of either flunixin or the placebo when the animal was moved from the calving pen. So immediately pre-calving, they received either the treatment with flunixin meglumine or the placebo treatment. Animals received a second treatment of either the placebo or the flunixin 18 to 36 hours later during the morning lockup. So shortly after the study was started, the researchers were notified by the herd veterinarian that there was an increase in the herd rate of stillbirth. When they unmasked the data, they were able to determine that the animals that were receiving flunixin prior to birth had an increased rate of stillbirth. So they had to change the protocol because this was not a research herd. It was a regular commercial herd. And of course, we don't want that on our herds. So in the modified protocols, animals received the first treatment of flunixin or the placebo about an hour after calving. When the animal was restrained for milking is when they gave that treatment. The second treatment occurred at the next day's milking, about 24 hours after calving. So the placebo that they used in this case was a saline solution. Interestingly, the milk production records from 1,265 animals that were enrolled in the study were analyzed for the first 14 days in milk, which is the graph that you can see here. From the graph, you can see that the flunixin-treated animals, which is this bottom line here, these are the flunixin-treated cows, and the bottom line with the squares is the flunixin-treated heifers, all right, that they had 1.6 kilograms per day less milk than the animals that received the placebo. Animals treated with flunixin also had greater odds of having a higher temperature, which was generally associated with mastitis or metritis. So 49% of the animals with a higher temperature were in the mastitis or the metritis group. Of the 51% of animals with a high temperature not in that mastitis or metritis group, 48% of them had a high temperature within the first 2 days following calving. It's important to note as well that flunixin treatment increased both the odds of retained placenta and the odds of metritis. So we mentioned this earlier that they had to change their treatment protocol because of an increase in stillbirth, but the researchers found that there was a 5-fold increase in the number of stillborn calves compared to controls because of that flunixin treatment before birth. So the researchers concluded that it is not recommended to give flunixin meglumine before or around the birthing period. So the next drug we're going to talk about is meloxicam. So meloxicam has been approved for use in cattle in many European countries as well as Canada, but not in the United States. Meloxicam is only available with a prescription from your veterinarian, and this requires a valid veterinary client-patient relationship and approval by that veterinarian for extra label drug usage. So meloxicam is known to be a preferential COX-2 inhibitor, thus targeting that inflammatory process rather than the physiological functions. So we're going to look at a study that was conducted by Schwartz et al. From 2018. For this study, there were 2 treatment options. Animals were enrolled in treatment options treatment option 1 received meloxicam between 6 and 48 hours before calving, and then a placebo treatment within 12 hours after calving. Animals that were enrolled in treatment option 2 received the placebo before calving in that 6 to 48 hour window before calving, and then they received the meloxicam treatment 12 hours after calving. So these animals are either getting meloxicam before calving or after calving. The control animals received a placebo treatment both before and after calving. So animals that had no issues calving, so that's this set of bars right over here, the Eutosha animals, and received meloxicam prior to calving, produced 4.3 kilograms per day more milk than the animals that had no issue calving. Animals with no issue calving that received meloxicam after calving, okay, so that would be this lighter gray bar right here, also tended to produce more milk than the control animals. However, the group of dystotic animals within the study did not show a difference in milk production. And it's important to note that extra label drug usage of meloxicam for milk production or any sort of like gain in production habits such as milk production is not legal. So keep that in mind. So the researchers also looked at the incidence of retained placenta, metritis, and rectal temperatures, same as the earlier study that we talked about with newbie. And they did not see an effect due to treatment with these animals. So meloxicam did not affect the incidence of retained placenta, metritis, or rectal temperatures. All right. We also in this study did not see an increase in the amount of stillbirth. So this was a good thing. All right, the last study we're going to look at, or the last chemical drug, is going to be acetylcyclic acid, or aspirin. And it's important to note that acetylcyclic acid and its derivatives are not approved by the FDA for use in lactating dairy cattle within the United States. So dairy producers that want to use this product have to contact their licensed veterinarian before use and receive a prescription for that, or not a prescription, but they need to work with them in order to use it, even though aspirin is available over the counter. So acetylcyclic acid is a weak inhibitor of both COX isoforms. So its beneficial effect, of course, is attributed to its ability to block the function of that COX-2 variant. So for this one, we're going to look at a study conducted by Berrigan et al. From 2020. So it's a relatively recent study. For this study, within 12 hours after delivery, animals received their first treatment of either the acetylcyclic acid or the placebo. And then they received 3 additional treatments provided 12 hours apart. All right, the animals treated with the placebo were given a gelatin capsule filled with water. So overall, cows that received aspirin produced 1.82 kilograms per day more milk. You can see here. So the aspirin treatment is the graph that's on top. And then the dotted line on the bottom is the control. So we can see that treating with aspirin increased the amount of milk produced within the first 30 days. Now, these researchers also broke it out based on the calving difficulty. And they did see that animals that had calving difficulty and were treated with aspirin had a greater increase in milk production. So those cows that experienced dystocia and received the acetylcyclic acid treatment produced 4.48 kilograms per day more milk than the cows that experienced dystocia and did not receive the aspirin. When they looked at the animals not experiencing calving difficulty, so this bottom graph down here, they did not see differences in those animals that were treated with the acetylcyclic acid or the ones that were treated with the placebo, indicating that there's really more of a treatment if they had calving difficulty. All right, the graph here shows that a lower proportion of cows treated with acetylcyclic acid developed clinical metritis at 7 plus or minus 3 days in milk. All right, so you can see this here. They had less, the treatment group is on the left. So they had less clinical metritis. They also showed that there was less clinical endometritis at 50 plus or minus 10 days in milk compared with the untreated cows. To date, there have been no studies conducted that provide aspirin before calving, so we don't know its effects on stillbirth. However, Dr. Berrigan and his group from Penn State have gotten a grant to work on this, so hopefully in a couple of years, we'll be able to read a study and know if there's issues with stillbirth and aspirin usage. Something you need to consider if implementing NSAIDs into your protocols is that you need to look at their withdrawal times and how many days after treatment you will need to discard milk, or if the animal needs to be shipped, what the meat withholding time is. So looking at this graph, we can see that the Meloxicam, depending on how you give it, has different withhold times for meat withdrawal, but overall flunixin has a milk withdrawal of 2 days, meloxicam has a milk withdrawal of 5 days, and then the acetocyclic acid has a withdrawal time of 1 day for milk and for meat. Another important thing to consider is that when you want to implement an NSAID procedure or protocol into your working habits of the farm, make sure that you're working with your veterinarian to determine what protocol works best for you, and then also to make sure that you are getting all of the right advice and the prescriptions that you need to move forward. So at this time, that's all I had for you. So it's just a quick rundown. If there's any questions, Ryan, I'll take those now.
Good stuff, Heather. We really appreciate it. Kind of a general question. So I was trying to think of a better way to word this, but any summary statements on the importance of timing when we talk about NSAIDs? You know, do we try and be proactive to do it before calving, after calving? Any clarity you can provide on what we know to date on that?
Again, it really seems to depend on the drug that you're giving. The thought process is that if you give it before calving, you can help to sort of alleviate some of the inflammation processes before you calve and add on to that inflammation. But as we saw with flunixin, that sort of backfired and caused stillbirth and retained placentas. The issue comes in is that those pathways affect the release of prostaglandin, and prostaglandin also causes the release of that placenta. So it's involved in that calving process and the release of those membranes out of the animal. So the strongness or the specificity of that NSAID for the receptor, the COX receptors, will depend on its ability and how much it can sort of like prevent that prostaglandin release. So that's why there is, like with the flunixin, they don't recommend using it around there because it inhibits prostaglandin too much and it's not able to do its function. With the meloxicam, we don't seem to have that issue. As you can see from this study that it gave it both before and after. So again, it really depends on the drug on when you want to give it. I think the results from the aspirin study that hopefully will be out in the next couple of years will be really interesting to see if aspirin has an effect as well before calving.
No, that's good to know. And thanks for walking us through that. I know that's one that there's a lot of digging, sorting through the fine details on this information to get to this point. So we appreciate it. If you have any questions, please drop them in the chat. I do see our poll is up. If you would please fill that out. We do have a few questions that we ask of you today. We really do look at these and we really do value your feedback. So we're going to leave that up here for a few more moments. With that, we just transition slides here to our upcoming sessions on the 31st, 7th, and 21st. So with that, we're going to be right back here, same time, same place, 1 week from today. So we really hope you can join us again then. With that, I really want to show appreciation to our 3 presenters today and also to everyone that joined us in the audience. With that, we'll just leave our poll up here for a few more moments. Again, look at our upcoming BDI sessions, and also hard to believe, but January is almost over, which means we start thinking about February programming, and that brings us to the Midwest Manure Summit. That's going to be February 28th in Green Bay, and further details are available on the website.